Our first speaker is a board member of the Compound Chapter. She is the founding president of the Compound Chapter and is the lead occupational health physician of the Asian Hospital and Medical Center, diplomate and fellow of PICOM, and assistant professor, family and community medicine, LPU St. Cabrini College of Medicine, Santo Tomas. Everybody, let's give a round of applause to Dr. Maria Antonia O. Yamamoto. Our second speaker is a supervising labor and employment officer from the Bureau of Working Conditions, Department of Labor and Employment. He's a Doctor of Medicine graduate from the University of the East, Ramon Magsaysay, also my alma mater, Dr. Ruby, and a fellow of the Philippine College of Occupational Medicine, and is a master in occupational health from University of Philippines. Everybody, please welcome Dr. Felix Labanda Jr.
Welcome, Dr. Felix Labanda. How are you today?
Last but not the least, from the medical legal perspective, is specialized in litigation, trial lawyer, and a forensic clinician. He's an MCLE lecturer for the Asian Center for Legal Excellence, co-author of the Basics of Philippine Medical Jurisprudence and Ethics, 2010, first edition. Wow. And he's an assistant professor and lecturer of the different colleges of medicine, law, and board review centers. And is a lead vocalist of the band. How do you pronounce this, Dr. Ruby?
Retromaniacs.
Retromaniacs. Okay, don't pronounce it in a...
Yeah, we heard it already.
Oh, Retromaniacs.
They play nice. Wow.
Please welcome, everybody. Please welcome. We are honored to have Dr. Attorney Antonio D. Rebosa.
Good afternoon, Dr. Rebosa.
Take it away.
Good afternoon.
Okay.
Are the slides ready? Yeah. Okay.
Good afternoon. Allow me to share my slide. Okay. Okay. Here we go. Sorry. So it's a rainy afternoon, and I know a lot of us are comfortably sitting behind our laptops and wondering what's going on. So our topic as a panel is navigating the fit to return to work, no, which is always an issue that a lot of us has. Now, what I'm going to do is to define what is fit or return to work, the criteria as we know it. How did COVID-19 affect the criteria, the impact, and of course, the new recommendations. Now, we know for a fact that there's a lot of changes with COVID-19. More importantly, there's a lot of species going on. So as a company or occupational health physician, our common problem is how do we now make our workers go back to work? Are they really fit? These are the burning questions that we ask. What happens if we give a fit or return to work to an employee and in 2 or 3 days' time turn out to be COVID positive, or at the worst with the coming and new diseases coming up like monkeypox and tomato disease? Will we as company or occupational health physicians be liable? So just as a review, fit for work means a medical assessment done when an employer wishes to be sure that an employee can safely do a specific task. No? So technically the purpose is to determine if the employee is really at the top of his medical condition and can do the task. Now, a fit for work medical certificate, on the other hand, is a formal document. So this is where the legal implication comes in. No? It's issued by a physician or an appointed medical practitioner, and in the workplace, that will be us, occupational health practitioner. This indicates whether an employee is physically and or psychologically fit to return to work after being absent for some time. The reason, of course, in the current time with COVID, we usually give them like 7 days to recover. So is 7 days, is 14 days, is 21 days enough? Now, these are the reasons why they need to be given a fit or return to work. No, one, there has been a significant change in their working condition. So, with the advent of COVID, we now have people who are working from home who are now slowly going back to their workplaces. An employee is transferred to a position where the working conditions are significantly different. No, so we have like patients or employees who had long haul COVID who will now be changed into a or given another post. And the job at work has been modified. So, as I've said, a lot of us were our employees are doing just this job. Now they have to go back and they have to probably do more of a desk job than what they used to do when they were working at home. And the most important aspect of all is there's a change in the employee's health. Bearing on mind, of course, again, long hold COVID. Now, other reasons for issuance is that the medical condition may limit, reduce, or prevent the person from performing a new or current job effectively. Like in the case of some nurses in Asian hospital, there were those who have lung problem and it's kind of hard for them to really now stay longer hours at the ICU, especially if they're using respirators. So it falls through with my other company, a manufacturing one. So we have to change their position. Likewise, this medical condition is likely to make it unsafe for them to do the job. So now we have an unsafe act in a safe environment. And of course, what needs to be looked into is the fitting of the job because the medical condition may be made worse by the job. So the question is, who should write the fit for work? I think in the advent of COVID, a lot of clearances has been given to the infectious disease specialists, to the pulmonologists, to the cardiologists, more so for the infectious disease specialists. I should be focused on the functional effect of their condition on their fitness for work in general. Now, what needs to be remembered likewise are the 4 components of fit for work and to return to work assessment. Number 1, of course, is the physical well-being of the patient or the employee. Can he still do the job? The next thing is, of course, the mental aspect. With COVID, with monkeypox, with tomato disease, are they still okay to do their task? You would notice that there were a lot of issues on mental health, and this is something that we might just want to ask later to our legal and DOLE speakers later on. The social aspect, do they go to work and just stay there? They now become presentism or presentees rather than, shall we say, more productive in their workplace. And of course, the financial aspect of things. We do so a lot of patients or employees who lost their job, but for those who are currently affected, they still go to work because they need the finances. The question is, which one is more important, the finances or the life? I usually say in my talk, kaya ka nga naghahanap buhay para mabuhay, hindi para mamatay. So the health and wellness of an employee is very important. Now, occupational health, in a nutshell, based on the OHS standards of 1960, aims to promote and maintain the highest degree of physical, mental, and social well-being of the worker. So we need to look in the prevention of decline in health caused by their working condition and now with the current pandemic and with the current threat of other pandemics. We need to protect workers in their employment from risk resulting from factors adverse to their health, something that would really make them, decline. The threat, of course, is actually not only in the workplace, but in the house, in their community as well, diba? in as much as we try to protect them from having COVID in the workplace, what happens when they go home? What happens if it's the family member who has COVID, who has monkeypox, and now here comes our employee going to work and probably spreading it there. So now the question is, how do we, as occupational health physicians, protect our co-employees, our employees from such, basing on the fit for work? And of course, there is a need to maintain and place workers in an occupational environment adapted to the physiologic and psychologic capabilities. We do have one employee who suddenly just stopped nung narinig niya na COVID-19 yung nakatabi niya. And there's a lot to be said about mental health in that case. There are employees who just have cough, colds, who refuses to go to work thinking that they might have COVID. And probably there are also employees, maghatching lang yung katabi nila, they now get scared because they think this person is bringing in COVID. No? So COVID-19 really affected the workplace and of course the fit for work. So there's DTI and DOLE interim guidelines. This will be further elaborated by Dr. Labanda. Now, what needs to be known is that there are those that we need to look into, and these are the four major things that we really have to highlight. And as I've said, this will be further elucidated by Dr. Labanda. Of course, at the end of the day, the purpose of fit return to work at times of COVID is to monitor workers who develop symptoms of COVID-19 or the disease itself. It is very important to contact trace and look at the outcomes of self-quarantine. And this falls heavily on the lap of the occupational health physician. Moreover, there is a need to document collaboration with health authorities. Now, probably what we need to know is what if we give a patient or an employee a fit to return to work and in 2 days' time comes back with a positive antigen or a positive RT-PCR. So how do we go about this? And this will be answered later on by our esteemed lawyer, no? I might be Tony girl, he's Tony boy. Ako po yung maganda, siya yung guwapo. So the role of testing, therefore, for fit for work is something that needs to be looked into, no? So DOH is saying employers are not officially required to have their employees tested for COVID-19, no? So for COVID-19, so it's like you can't mandate somebody to do the testing unless it's covered by the company and it's in the policy. So there is no need for a regular testing, and I think Dr. Labanda will agree with me there. However, what is mandated is that there is a screening and monitoring of employees to promptly address those showing symptoms. So we have to be very vigilant. So how do we adjust, therefore? We have to look at the employees before returning to their workplace. We have to do complete assessment. We have to look at the physical and mental and social well-being of the patient. And I think what needs to be added is on the next couple of days while they are working. So there will be a lot in discussion, but let me end up with this. There is no book on how to get back after COVID-19. We're all figuring it out together. But a return for work assessment is a good first step to safely reopen and understand employees' needs. With that, I would now like to turn the floor to our next speaker, Dr. Labanda.
Thank you very much, Tony. Are you able to hear me? Okay.
Yes.
Okay.
Okay, thank you. So I'll be sharing my screen. Wait. There. Okay, are you seeing my screen in presentation view? Hello? Are you seeing my screen in presentation view?
Yes, Doctor.
Okay, so good afternoon to everyone. This afternoon, I will be discussing to you return to work in a time of pandemic. So I am not really going to focus on the COVID-19 itself. Rather, I'm looking at a bigger picture on how you're going to apply the concepts of return to work in future diseases. So, for example, we have already have monkeypox. We have possible future pandemics or future diseases that would necessitate for us to be extra vigilant in our workplaces. So for my disclosures, I'm currently with the Department of Labor and Employment and also currently a member of the HPAC. And I was previously a representative for the National Task Force on the Management of Emerging Infectious Diseases. So for this particular afternoon, we need to consider 4 decision points. Who do you consider when you're creating a return to work decision? What do you consider? Who you should consult, and how you would determine the fitness of work of a particular worker. Now, the considerations could be placed in this particular table. On the top or in the columns, you are looking at the patient, the other workers or the co-workers of your patient, the clinic team, the management, as well as others. So these are your third-party concessionaires. Now, aside from these persons, you need to look at the factors that would be something that you should consider when you are creating a decision. So I was, as mentioned by Dr. Tony Yamamoto a while ago, there's a factor of presenteeism because of the need for continuous supply of income or continuous flow of income. And then there's also leaves and other benefits. Do they still have benefit? Do they don't have benefit anymore? Or they no longer have any benefits? This is also true, especially for workers that are already that have already consumed their leaves, especially if they had long COVID. There's also the workers that are just new to the establishment and did not have any opportunity to earn the service incentive leave by the government. And then, of course, the retirement benefits. Can the retirement benefit at 60 years old outweigh the benefit of retiring early rather than exposing yourself to COVID-19, for example, in the workplace? And then there's also the related diseases, such as mental health. I am focusing on this because we have Department Order 208 regarding mental health. However, there are also other comorbidities that you should look into, such as HIV status, for example, or diabetes, or hypertension, or any other comorbidities that are actually related to this particular pandemic. And then, of course, there's future at work. How long, or what is the risk of them having a better future in the company, as opposed to them being retired or have early retirement. Now, considering these factors, you just have to look into the patient. If it's of course, the absence or prolonged absence of the patient would result in a loss of income. However, if you're going to prematurely allow the worker to return to work, then there would be a potential loss for income of the others that will be affected, as was discussed a while ago by Dr. Yamamoto. They are present, but they should not be there. Okay, so this has been a question to us by one of our callers in the bureau. What if a worker was found to be positive for COVID-19 and the worker knew that he was positive but still went to work? What would be the repercussion for that particular worker? Could they file a case? Could they file damages to the worker? So for that particular situation, the first point that you should ask is is there a policy and program on COVID-19 control and prevention in the workplace, as was required by the DTI and DOLE JMC 20-04-A. Remember that you cannot put a sanction on someone for policies that do not exist. Okay, so this will be clarified by Dr. Rebosa later on. But it is very important that when we say that we need to have something written down, something cascaded, your OSH program for the workplace policy and workplace control and prevention for any of the diseases that we are looking out for should be in place. Because if it's not in place, technically, there was nothing violated. You would say, oh, the government does not allow that. Where is it written? The government actually does not allow for the workers to be shouldering the tests. Even now, at alert level 1, all places at alert level 1, you do not require your worker to undergo the test. So what if there's a test? The establishment requires a test. Then that would mean the establishment should pay for that particular test. What if the worker refuses to have the test, even if the company is paying for it? Does the worker have a sanction? That depends. Do you have something written? Again, nothing written, no sanction would be allowed because that would be tantamount to the use of power, use of authority, unjust use of authority, right? So, and also you have to look into the other considerations, especially for the fourth column, your clinic team. This is often something that is looked over because the clinic is supposed to be there at all times, but it's not really being considered. Now, oh wait.
I didn't understand that.
Okay, so for your company occupational safety and health, you should look into the different sources of your policies. So of course, there's the DOLE issuance, which provides additional guidance and ensures institutionalization of government-mandated projects. But remember that in every pandemic or in any pandemic, the primary consideration is actually the Department of Health because they are considered as the expert in this particular field. We are just cascading into the workplace something that they have already produced or they have already provided guidance. Now, what is the value of the IATF? Why is there a DOH issuance and there's an IATF issuance? It's because the DOH releases an issuance relating to primarily health. However, health is not the end of it all. You need to earn money to promote your health, diba? So that is why we have the IATF resolution because the IATF resolution also considers the inputs of the Department of Labor and Employment, the Department of Energy, the Department of Tourism, because these are the essential or critical factors that is essential for work. So the consideration for the Department of Trade and Industry is also incorporated into that. And then of course, we also have the PCOM as a source, a primary source of your information for your workplace occupational safety and health, and then the World Health Organization. For situations that are infectious related or infectious control related, of course, you need to create or you need to get your sources also from other members of the Philippine Medical Association. So you look into that. Now, for consideration on collegial consultation, is it allowed? Of course, it is allowed. That's the reason why we have the Philippine College of Occupational Medicine. It's not just here as an institution, just so that you're going to be attending conferences. The purpose of this is to create a network for your collegial consultation because at the end of the day, it increases the potential for you to have future collaborations, partnerships, and be guided in issuances because you have multiple sources. Just make sure that you are getting the correct information. Okay, because some of the information are a bit outdated. Now, who are the key people that you have to look to talk to? So you have your internal colleagues, which is your HR, your clinic team, and then your HR or administration because they are the implementers. You look for the college as a part of your guidance, and lastly, you have to consider OSH committee of the company as a primary prime mover in terms of your occupational safety and health policy in the workplace. Now, the fitness to work determination for a particular employee could be summarized into five sections. So the disease process, if it's completed or not. So you have to know the pathophysiology of a particular disease, the immune status of your worker, the exposures of other workers, the exposures of the worker himself, if he's going to be continuously exposed, and of course, if alternative work arrangements are available. Remember that the alternative work arrangements should not diminish the benefit of your worker and should not be a form of discrimination. Then, lastly, when you look into the considerations that you're going to create in your future policies, you need to take into consideration government issuances, the business direction, if you're already at critical, you're almost failing in the business itself. The disease course, if there's an update on how the disease is progressing. The worker decisions, you have to consult your workers. You do not just make them recipients of your policy and program, because sometimes our policies and programs are harboring on trampling on human rights. And of course, other guidance such as from those of the other organizations. So I think this is my last slide. Thank you very much for listening. I turn you over to Attorney Rebosa. Attorney?
Thank you, Doc Felix. Sorry, I'm still mobile up to now. I got caught in and some places are already flooded. So it's a rainy. Right, so I'll just be dealing with some generalities with regards to giving work clearances to our employees. And of course, it also entails legal responsibilities. No? All right, we have no choice now but to practice the use of legally safe and defensive terms. No? One that you can safely defend. Sorry, wrong spelling pa siya. No? If you recall, so many years back, whenever a patient would undergo surgery and if he's over 40, it's SOP that he would undergo what we call CP clearance or cardiopulmonary clearance. And then the cardio would go there, see the patient, and then write in the chart, cleared for surgery. And then later on, patient undergoes surgery and the MI, something bad happens and dies, and autopsy shows that he had some heart problem. So this is trouble for the cardiologist who cleared the patient. Okay, so because of that, they now changed the term to risk assessment. So meaning the cardio or the pulmonologist would go and see the patient and assess the patient as to whether he's mild, moderate, or severe risk for surgery. And it's up to the patient to decide whether to undergo the surgery or not, depending upon the evaluation of the cardiologist. So this cardiologist now played it safe. They're not using any more CP clearance. They're using the term risk assessment because it's a no-no. No? Clear niya tapos namatay. So ngayon, risk assessment, it's up now to the patient to decide after the cardio had explained to them that the possible risk and complication of surgery. So same thing with us doctors who are issuing fit to work certificates, being company doctors and the like, to also, I guess, practice safe terms, legally safe terms. Kasi pag sinabi mo fit to work, and then something bad happens to the patient, okay? And yun na nga, hindi lang physical, mental pa yan, no? Then we might get into trouble. So perhaps the better term to use here, may return to work subject to blank or provided that blank. No? Yung may. So again, when you say may, also the responsibility of going back to work of assessing whether he could really work, would also be on the subject himself. Okay? So siguro importante, no? Yung the term that may undergo contemplated activity. So you'll have to ask what is the type of work that he is doing. Okay? And also maybe you have to put there as of this time, as of that particular date, no? Because he might be okay now and he might not be all right tomorrow. So again, when you issue your medical certificates, always try to make it safe for everyone, legally safe for you, especially for the doctor, no? Because again, this would be subject to interpretations, and lawyers will interpret it, no, against you always, depending on whose client they're handling. Now, just a reminder to everyone, no, under Article 174, false medical certificates, no, or knowingly issuing a false medical certificate is a crime that most doctors commit. So it could work either way for you. No, you issued a depending upon the patient. If the patient is trying to coax you into, let's say, doc, pwede ba ilagay mo dyan, fit to work ako, although may cough and colds ako kasi kailangan ko kumita eh. No, and then the patient and then you issued a medical certificate, and then later on pala something bad happens also to the patient and all to the others, no, in the workplace. Okay, so that would fall under that. Or on the other hand, no, the request is the opposite, no, so ganun pa rin. Okay? So again, no, the penalties of arresto mayor. Arresto mayor, actually, that means the prison term for that is a minimum of 6 months up to 2 years in prison. Okay? Plus administrative liabilities. So a case can be filed against you also at the PRC for revocation of your license. Now, mere mistake in the content of the medical certificate will not suffice. No, if it's an honest mistake, yun ang defense natin. You thought it was like, but if they can prove that it was gross, no, you were grossly negligent, or of course, if there's malice and bad faith, you were asked by the patient to certify, no, something that is not true, then that would be a deliberate issuance of a false certificate, which is punished. Okay. Now, the employee who makes use of a false medical certificate would also be liable criminally, no, under Article 175. So both the doctor and the employee who conspired to have that medical certificate, no, which is considered false, and there was really an intent to defraud, no, then both would be liable under the law. So I think I will end it there, and hopefully we can have a great discussion, no, from the questions that you may have. It's great to be with Dr. Labanda and Dr. Yamamoto. Okay, thank you so much, and I think we're ready for your questions.
Thank you very much to our three panelists. In fact, there was one question in the, not in the Q&A, but in the chat box. No, let me read it again, no? For everybody. It wasn't sent in the but Dr. Felix already answered. It wasn't sent publicly, no. So here's the question, just to start the ball rolling. One of the participants asked, can we always set guidelines in our company beyond the guidelines set by the DOH IATF? Is that legal? So Dr. Felix clarified, you should be guided by the guidelines but not go beyond it. Similar to the implementing rules and regulations, you cannot over-prescribe beyond the law, as this would be usurpation of authority, as the authority to create the law rests on the Senate and Congress. So have we, are there follow-up questions or clarifications?
Yeah, I think Dr. Mon,
Yes.
Dr. F made a follow-up, meaning, I mean, more than the guidelines set by the DOH, doing home quarantine when coming from outside. Now, remember, my thoughts on this is, if you are creating a policy and program, you have to make sure that you are not overly prescribing, because it's very difficult to monitor. And remember that any violation of these policies and programs may lead to a loss of income or possible sanction to your worker, which we do not want because it is already a very difficult life. And it could be a form of discrimination, or you may be trampling on their human rights. Now, when they ask, when you say, oh, you were in contact with someone from that is COVID positive, you need to be in quarantine for 14 days just because I want you to be in quarantine for 14 days. Who would pay for the loss of income? That is okay if it is to work from home and there is no damage relatively to the income source of the worker. But if there is a loss of income, heads will roll. That is that is always, even in with us in the department. If something is wrong and it is not addressed, heads will roll. Thank you. The Dr. Yamamoto, Dr. Rebosa, you may have something on this.
I think si Dr. Rebosa is more legal, no? Just to note lang, in our company, we have that policy really that in case you are exposed, there is that option to work from home. And we try to adhere with the DOH guidelines because the DOH guidelines naman is very specific, especially now that there is a lot of people who are who had their vaccination. No? So I guess it's just really aligning the need of the company in terms of manpower and the protection, of course, in terms of the emerging disease. Attorney Rebosa?
Yeah, thank you, Dr. Well, Dr. Felix is very correct there. No, of course, the company policy should not be over and above what the law prescribes. So, company policy should be subservient to the law. No, of course, all policies of the company should bode well for the benefit of the employees and everyone. And again, it should not be against public policy, public health, and all those stuff. So, of course, we cannot stop management from imposing policies or with sanctions. But again, this should all be subservient to what is the present law. Policies are now changing. Everything is being again, medyo liberal na muna ngayon about the mask, mandate, and the like. So you should also adapt.
Agree. Just to clarify, dear panelists, for example, one company is still sticking to the parang 10 days instead of the 7 days. So, I mean, are they in any violation? They meet the minimum, but they would like to go beyond. So, is there any violation?
I would like to answer that first, Dr. Mon, Dr. Ayam, and Dr. Tony, if you don't mind. So for this particular instance, I have encountered a lot of companies that are still practicing antiquated policies and programs. This is because, one, they don't have a safety officer. Number two, they don't have an OSH committee because supposedly when the Department of Health, the IATF or the DOLE comes up with a particular guideline, it automatically has to update all of your policies and programs relating to that particular situation. If you're saying that, no, we stick to 10 days, but someone loses their income because you're sticking to an old policy or guideline, then the loss of income could be charged against you. Am I right, Dr. Tony?
Yes, that's true. No, so it's really very important to update yourself in terms of the guidelines. Kasi recently there is even this policy that for exposure, as long as you're vaccinated, then there is no loss in terms of reporting to work, especially if you're asymptomatic. So meron pa nga crisis-based management, no? So you lessen based on the needs as long as it's proven that you are not highly infectious or you could be a threat to anybody in the workplace. Dr. Attorney Rebosa.
Yeah, Doktora, pareho tayong Tony.
Oo. Ako yung Tony Pretty, ikaw yung Tony Guapo. Sige.
Anyway, isa lang isasagot ko dyan, Doktora. If the employee feels aggrieved, there's nothing that would stop him from suing you. It's so easy to sue doctors. No, left and right dyan. They would be filing complaints not only with the company, but they can go straight to the PRC or worse, wag naman sana, yung social media. Mas malala nga yung social media when they try to
Trial by
aim
publicity.
you there.
Oo.
So again, times have changed, no? So everybody is so empowered. That's why doctors should also be careful. I myself also, when I was taking up law, was also working as a company doctor in several hotels. So I know how it is, no? I know how employees will try to coax you into putting this and this and that. So don't get pressured. And then of course management is also telling you this and that. So nandun ka sa gitna. So you have to balance things out. But as doctors, whether we are, of course, you're working for the company, no, still do not forget our Hippocratic oath. As long as you're true to the Hippocratic oath, at least it's defensible. But again, as I'm saying, nobody can stop the union from filing complaints against you for the company.
Yes.
Noted. We have three more questions in the Q&A box. Probably I'll go with start with the first one. No? It's quite big. Is it illegal to require employees to undergo COVID testing even if it is in aid of diagnosis? I don't know what particular situation. From an anonymous attendee. Is it illegal to require employees to undergo COVID testing even if it is in aid of diagnosis?
So
Maybe Doc
for
Felix
this,
would start first.
yes, thank you. For this particular situation, we have a labor advisory. Labor advisory 7 says that you can workers are not supposed to be charged for anything regarding COVID-19. So you may want to test. That's no problem as long as you're not going to force the worker to pay for the out of pocket for this particular situation. It's a different issue if you're the company and you're already paying for it and the worker refuses. Because if the worker refuses and the worker seems to be manifesting symptoms of COVID-19, you have every right to protect all other workers in the company, and you can force the worker to be unfit for work because that is your judgment call. However, if you're going to say, do an antigen, an RT-PCR, and that's out of your pocket, no, that's not allowed. That's against the law. Thank you.
Yeah, I think one of the problems kasi is there's a lot of companies now doing antigen testing for return to work, no? Just to be sure that you're not carrying the virus. But then again, the burden falls on the lap of the worker. So ang problema, they will have to pay for that. As Dr. Labanda had said, as Felix had said, there's really no mandate to do mass testing even, no? Yung random testing pa nga dati, random drug testing. Ngayon, random COVID testing. There is really no need for that.
I fully agree with both my co-panelists. I have nothing more to add.
Clarified. Thank you for your answers, panelists. We have a second question here. I don't know to which this is corollary. So what do we recommend if that particular individual is also on no work, no pay terms? Is this maybe we touched earlier something about the leaves?
I guess I would answer that because it has something related to wages. So for this particular situation, if there's an option for alternative work arrangements or the work from home, that is, you tap on that as a means for those that are antigen positive that has to have quarantine for 7 days because they are already at no work, no pay, to ensure that they have continuous income. However, if your patient is an embalmer, if your patient is a street sweeper or whatever, they definitely cannot take the work home. So you have to say that you need to file for a sick leave. Okay, that is why it is essential that for those of your companies, you have to tell HR, ensure that everyone is getting their SSS contributions paid. No SSS contribution, it's a problem. It's a big headache. The SSS benefits will still be given to the worker. However, the SSS will sue the company for the damages to SSS. Am I right, Attorney Rebosa, on that? I think, yeah.
Yes, they will go after the company.
Yes.
Right. Yes. Okay. Any addition, Dr. Tony, on that?
Yeah, I think
You experience?
my experience talaga, honestly, there's a lot of, well, even as doctors, no work, no pay, di ba, when you do clinics. So the idea, of course, is if you have your own SSS, I think from the previous postgrad that we had, there's really a lot to be said for people having their own SSS, contributions to PhilHealth, and well, pag-ibig is more house loan. No? In case, I think what they're talking about here, Felix, is yung mga provisionary. No? So more often than not, they don't have really the provisions for such. So it's best talaga to encourage them to do self-contribution.
Yeah, okay. I think there are 1, 2, 3. I think we have time now, so let's take up another question. Good afternoon. May I ask what are the latest guidelines from the DOH regarding the length of isolation for symptomatic employees? Is it still the IATF resolution issued last June 4 prescribing 7 days for fully vaccinated? There are many private decisions who issue fit to work tests and give 1 to 2 days rest for URTI, acute pharyngitis. Thank you. So, are there any new issuance? What can you say about this, Dr. Labanda?
Okay, so for the issuance, it's all still IATF issuance, which is June 4. Yes.
Still effective.
And it is still referring to the Department of Health Department Memorandum 2022-0013. So we have to refer to that because, again, our decisions are always legal in nature. Even if you say even if you write in your certificate that this is not a medical legal document, it is a medical legal document, and it will be subpoenaed in court, and it has to have a legal basis. So if you're going to say that IATF says that workers that are symptomatic should be at this particular quarantine days or isolation days, and they are required to have a test or no test, it should be referring back to that particular document. Because if you're creating a decision based on, I think this should be okay. That is true for non-pandemic times. That is okay. Because remember, in my lecture a while ago, when you're giving a fit to work, you also have to consider all other persons that will be exposed to this particular worker. This is especially true if you are going to consider the Omicron variant that is quite fast to spread, right? So, and if your company is multinational in nature, the probability of you having workers that are coming in from overseas flights is there. So the probability of you saying that, oh, it's not really that transmissible, you don't know that because transmissibility changes depending on the variant that is there. So you always go back to the latest guidelines. You always look at the DOH website for IATF. Thank you.
Thank you. Thank you, Dr. Dr. Tony, what is your personal, do you have experience with this? 1 to 2 days. Grabe, no?
1 to 2 days.
Well, the only experience that I have with this are those who are insisting to go to work despite the fact that they're symptomatic.
Agree.
And a while ago, Dr. Felix has mentioned that maybe if the company can sanction these employees. So it may not be so, but employees who are affected by it, no, if they turned out to be positive or if they knew they were positive, still went to work and infected the others, of course, criminal case can be filed against these particular employees. It's not, or the company by itself, no, and the employees can file it.
So it is, attorney, it is covered by the revised penal code, such
no, it's more of the IATF, the law that was passed just when we had the lockdown, no, last March 15, 2020. It still persists. It's still in effect up to now.
Okay.
So if you know in bad faith in that you know you already tested positive and you still went out and infected others, like ano ba yun sa Quezon City, she just pleaded guilty, yung alam na niyang positive.
Yung ano po, yung lumabas po sa Berjaya. Wrong quarantine.
Oo. May term sa kanila, no?
Oblasyon girl.
Again, half of lasted girl, correct si Doc Felix. So, ganun din ang pwede mangyari sa mga employees natin. No, if they already knew, they were symptomatic, and they were already told by the doctor not to work. But if it's the other way around, the doctors insisted, "De, kaya, okay lang yan, sige mag-work ka." The doctor might be in
The doctor
trouble.
is the one liable. No?
Yes.
So yung attorney, yung presence of malice, yung po ba yung factor yun?
Well, kahit na walang presence, well, for the doctor, no, it would be more of negligence.
Negligence for the doctor.
Yes, oo. And if attended with in bad faith and malice, the more that it aggravates his case.
Okay. Dr. Tony, you have...
I think si Dr. Ruby has a question. Dr. Ruby, nakamute ka po.
live, si Dr. Ruby would like to ask a question live.
Oh, yeah, like, this is so important kasi it just came this morning. This patient, doctors, she is positive for PTB pneumonia. And working in, PTB pneumonia, medyo escalated na yun kasi symptomatic po siya and is a bacterial case. So I asked agad, where is your family? Where are your co-workers? And she just cried. You know, she doesn't want to involve the co-workers kasi they may all be, made to resign kasi nga may sakit if all of them will be positive. How do I report this po? Kasi I'm so concerned with them spreading to others and to their families when they go home to the families. Kasi they're staying in a place where they are all grouped together. And I asked them, there were 6 of them. Can you imagine 6 spreading them if they are all positive? That's the concern po.
Siguro, Doktora, you have no choice really but to report. I know your heart is with this particular patient of yours, but it's your head that will roll.
I know, sir. Well, I did make her sign a promissory note that she will bring her co-workers, but that's just about what I can do. I told her, susugurin siya ng LGU pag hindi siya nag-report sa akin.
This is a reportable, if you consider it as contagious, no?
Yes, very much contagious po.
The DOH requires us to report it to them.
Mm-hmm.
Failure to report, Doktora, lisensya mo at saka baka may
I will. That's why I came up with it.
Yes.
I will, sir, yes. Of course, I will. And any more other questions?
We can read, I think we still have time. From our very own Dr. Abseler Rason. How about COVID tests that can be covered, still on testing, no? How about COVID tests that can be covered under PhilHealth, universal health care? Instead of the company paying for the test, I guess the question is saying na, if PhilHealth will cover it, can the company just mandate it or order it to employees?
Okay, so for that, I have yet to see PhilHealth cover tests that are not done in the hospital setting. So usually, if you're going to request for an RT-PCR, it's usually because your patient is already symptomatic and is usually in the ER. However, if you're just considering the probability of COVID and you're requesting for an antigen or RT-PCR, I am not familiar of a PhilHealth coverage for that. I don't think they have a package for that. I'm not sure about Attorney Rebosa on this.
I don't think so also, no. They even want the hospital, no, to cover for the cost of the hospital's employees, and even the patients themselves could not even collect with PhilHealth. They will have, so there's really a problem there. So this will be to the account of the company.
Okay. Dr. Tony, do you have?
Yep. By experience kasi, again, requesting to have the test done under PhilHealth is really a financial nightmare. But actually, there is no, as far as I know, there is no actual coverage. It was initially at the height of the pandemic earlier on, but recently there is none, except of course when the employee is admitted, then that becomes covered by PhilHealth.
Okay, agree. Okay, so We have no more pending questions in the chat box. Probably we still have time for one more. Or from our panelists, would you each of you would like to parting words or to recap the session? Would you like to give a summary or parting words, final message to our audience before we close this portion?
Sige.
So, yeah.
Sige, Dr. Tony Ganda, you grace me. A beauty before everyone else. I'll go.
Sige, claim ko yan. Anyway, just remember as occupational health physician, it is actually our task to, be vigilant in screening, writing our return to work certificates. We have to be balanced in looking at what the company needs and what the employee needs. At the end of the day, what needs to be done is to protect the workers and the company itself from the spread of the disease. Yun lang po.
Thank you.
Okay, so and susunod na ako na Attorney Rebosa. So final words ko lang po. Always remember that when you are issuing a fit to work certificate, you're creating a decision not just for the patient, but for the entire establishment and for the entire workforce. If your decision drastically affects the entire workforce, it's not just a loss of income for one individual. It affects everyone in the workforce. So make sure that you are not tempted by your heart to provide income to a person that will potentially contaminate your workplace. Thank you.
Very nicely put, Dr. Felix. Thank you. Attorney Dr. Rebosa.
Yeah, I just want to thank PCOM again for having me in your program and for, of course, being with Dr. Yamamoto and Doc Felix. The only last words I would have is, of course, know the law and be ethical in your practice. So if you are, even if they file cases against you, you're in good stead and you have nothing to fear. Except perhaps, no, syempre, you cannot also predict what's going to happen. I've seen stranger things na even if the doctor is not at fault, now we lose the case and vice versa. But it pays to know very well the rules of the establishment, of your company, and that of course also of the law. And I do hope that all of us would be steadfast in following our ethics as mandated by our profession. So again, PCOM, thank you so much. And it was great being with Dr. Yamamoto and Doc Felix.
Thank you very much, Attorney Rebosa, for that nuggets of wisdom, legal advice. Okay, at this point, allow me to thank our speakers for a very interesting discussion. It's good to know there are guidelines or tips that will help us navigate this, how to arrive at fitness to work, at this point, we'd like to issue the individual certificates for our speakers, for our panel. Thank you.